When paying for physical therapy, many patients use their health insurance because it can typically lower the overall cost of their treatment. But what if you need physical therapy and you don't have health insurance? You may worry how you can afford it, especially if you're recovering from an injury or even surgery. By the end of this video, you'll know exactly what to expect your out-of-pocket costs to be and some tips on how you can save money. With this information, you can go into your physical therapy treatment knowing what your overall cost will be.
Hi, my name is Marika Sanchez, and I have been part of the billing department for over 10 years at EW Motion Therapy. Part of my daily tasks are posting charges to patients' accounts, as well as answering any questions they might have regarding those charges and the cost of them. Today, I would like to review what you can expect your out-of-pocket costs to be, what factors can influence that cost, and how you can save money throughout treatment. The cost of physical therapy can differ and can go anywhere from $55 to $350 without health insurance. These prices can vary due to the amount of time spent or the complexity of that visit. For example, your initial evaluation might have a little bit longer time and be a little bit more thorough than the rest of your visits, causing that first one to be a little bit more expensive. At EW, our costs range anywhere from $55 up to $155, with that $155 being the highest price point for your evaluation. There are many factors that can influence the out-of-pocket costs that you may pay for physical therapy. One can be where you live and where you're having your physical therapy. Another can be adding specialized interventions to your actual session, such as dry needling. If you add dry needling to your original session, you may have an additional cost. One of the most important factors to think about whenever you're analyzing your out-of-pocket cost is your diagnosis and the reason for you coming in. Let me explain. A patient that is coming in and is recovering from a stroke may require longer and more thorough treatment compared to someone with an ankle sprain. So that cost might be a little bit higher than the person with the ankle sprain. First and foremost, it is always important to have an open dialogue with your therapist. That way they can tailor your treatment to your budget. One way that they can do this is during the first visit, depending on your diagnosis and what you have going on, they can create a home exercise program. The way this works is that during the first visit, they would create this for you, so that way you're doing the bulk of your treatment at home with follow-up sessions after. This will decrease the amount of visits that you come in and therefore decrease your cost. Lastly, most clinics will work with you in order to set up a payment plan. This will ensure that you get the treatment you need that fits around your budget.
Now you know more about the out-of-pocket costs surrounding physical therapy and some tips on how you can save money. If you have health insurance, we do recommend that you use it. Click the link in our description below to watch our video on the cost of physical therapy with insurance. This video details how health insurance can affect the overall cost of your treatment. If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.